Hi, committee. My name is Brittany McKinney, and I'm a graduate student at WKU and an MSW intern at Kentucky Trauma Therapist. I have a strong commitment to advocate for policies that promote equity, safety, and the well-being for our communities. I appreciate the opportunity to speak with you today. I'm going to be advocating for the Senate Bill 35, which I believe is a critical step towards addressing issues relevant to have access to women's rights and abortion topics. I'm here advocating for the significance of Senate Bill 35. This was introduced to the Kentucky Senate. The bill proposes amendments to existing abortion laws that allow exceptions in specific circumstances. The bill permits abortions when there is a lethal fetal anomaly or the fetal is incompatible with sustained life outside of the womb. It supports termination if the pregnancy is a result of rape, incest, or if the fetus has not reached viability. This can be determined by a medical professional using medical judgment. Additionally, this bill seeks to establish a reputable presumption that physicians comply with the requirements and provide exceptions to specific consent and counseling mandates in cases of rape or incest. About 10 to 15% of known pregnancies end in a spontaneous abortion or miscarriage in the United States. This is a common complication of pregnancy in the country. A miscarriage is defined as a pregnancy loss that occurs before 20 weeks of gestation. These are sometimes called spontaneous abortions. Sometimes it can be caused by a chromosomal abnormality or a maternal reproductive tract that just didn't work out. The medical term for a miscarriage before 20 weeks is called a spontaneous abortion. I'd like for you to listen to a scenario with me. There's a mother and a father, a husband and wife, that go to their first doctor's appointment that they've waited weeks for. They eagerly get their ultrasound and they are waiting to see how far along they are. And their tech was really quiet and they never got to see the heartbeat of their baby. And they could just tell that, something was a little off during this appointment. Instead of the tech saying anything, she told the young couple that the doctor would be in to see them pretty soon. As they waited for the doctor to come in, they imagined the worst possible. They didn't think that that was a routine visit like you'd see in regular appointments. So the doctor came in and the couple was informed that the mother was 12 weeks pregnant, but the baby had stopped growing at 9 weeks. The mother's body was still fighting to protect the baby. However, the baby no longer had a heartbeat. Ultimately, the couple were very sad because it was a baby that they had prayed for. However, the doctor wrote them a medication so they could medically pass the baby, and the mother went home and later went to the pharmacy to get her medicine filled. Once she went to the pharmacy, she tried to fill her prescription, and the pharmacist told her that he couldn't allow her to have the medicine because she wasn't allowed to have an abortion. The mother pleaded with the pharmacist that she wasn't having an abortion, that her baby was already dead inside of her. However, the law had just passed that you would not be allowed access to medications that would give you access to abortions. So the pharmacist had to tell the mother no, he couldn't give her the medication. This would go on for another 2 to 3 weeks while the mom walked around knowing that the baby was dead inside of her, being denied access to medically necessary interventions to pass her baby. That mother was me. I'm one of the 15 to 20% that miscarried and had a spontaneous abortion. The negative effects that it had on me affected my mental stability as well as the anxiety around the situation. I support Senate Bill 35 because the pain and the trauma that I experience is only a little bit that other women experience going through similar situations. There's an emotional toll that comes along that losing a pregnancy is already enough, but this doesn't even include the situations where somebody was raped, molested, or incest. No one should have to endure unnecessary pain, fear, or complications because of restrictive laws that fail to account for medical realities and individual circumstances. It's essential that we pass this bill so women have access to the health care that they need. There are different studies that show whenever women are denied access to medical interventions, they actually have higher debt, lower credit scores, and they're likely to be employed less than full time. The American Psychological Association has also stated that abortion restrictions contribute to mental health distress, and there's no evidence that abortion causes long-term mental health issues. I believe that if we can utilize public awareness and if we can get women to band together as well as men, because these are your sisters, your aunts, your friends, your cousins, and potentially your future daughters that these rules and these laws are going to affect. Qualitative and quantitative data can be used, and we can develop comprehensive documents outside of these bills legislations to advocate for the passing of the Senate bill to encourage the access of abortion rights as a medical necessity and take away the political influence of it being a religious issue. I urge you to look into the laws around Senate Bill 35 and to continue advocating for the women's rights that we so hardly fought for a long time. Thank you for your time, and I appreciate your efforts in continuing to fight for our advocacy.